Hello everyone. My name is Randy Cummins and I'm with Black Swan Bodywork here in Austin and Chicago. And I'm with my good friend Joy. And we're going to do the first of a three-part series of videos here today, addressing a couple of the common ailments that we as therapists and quite frankly as people run across all the time. And I'm speaking of lower back pain into hip pain, and persistent stress and tension in the shoulders and neck, leading into, unfortunately, some headaches. So, in addressing the problems that we're talking about, we're going to look at the probabilities of what's causing these problems. And quite frankly, this is a very good approach to really solve the problems and to allow yourself to work through any temporary stagnation back into a sense of homeostasis or optimum health. Because this is what we're trying to move towards. So in that said, we're going to start here with Joy at the feet and try to make sure that all the alignment here in the lower body is clear and functioning well so that she can move through her life in an easy fashion. A lot of times any hesitation in the step or decision making ramifies into our physical body, and we start having some sort of muscular imbalance. It's just our body responding to how we are, either externally or internally. That's the magnificent part of the human body. So in working for the feet, we're just going to start creating some looseness here. Particularly my focus right now is at the ankle. Anatomically, there's some connective tissue here called the retinaculum. It's like a band-aid that helps support the ankle. So here, continuing working on this retinaculum, that connective tissue around the ankle. Like I was saying, we need a full stride. We're trying to get a full loose stride. So it follows that the legs, the hips need to be open so that they can allow us to walk and take our weight as we're doing our own activities. So this simple movement of range of motion really helps open up the ankle one way and then the other. And a nice twisting motion where the hand comes around and supports the bottom of the foot, and then as we inhale and exhale, we rotate, creating some nice space and a twisting motion in the foot. This really helps with problems that can lead up to more serious imbalances like plantar fasciitis and things. It helps relieve all the tension that's felt in the ball of the foot when it gets a lot of the weight when we're walking or doing any activities. I know that Joy is a wonderful yoga instructor and she does a lot of balance poses, and she really is aware of how her weight is coming through her lower body into her feet. The hamstring stretch is also very important to help keep the hips and lower back loose. So we always check range of motion here for the hamstring. It's a lovely full range of motion here. Goes up easy. That's what you're looking for. And that movement opening up this area here just below the hip, they're called the hip flexors. The quadriceps are very beneficially dynamic as far as how they support us in an upright position, but also power us through a lot of activities. So this simple stretch here where I'm just using my body weight, and you can see the motion here through her hip and up into her lower back is where we're keying right now. Just trying to create some nice movement and space in the lower back. And just building on that openness, this type of work that I'm demonstrating is called Shoshin Shiatsu. It's an integrative form of Asian body work, combining both classical acupressure and shiatsu with Thai moves. So it helps open up the physical, but also it addresses the energetic pathways in the body. You can see these nice simple stretches here that not only open up Joy's hip, but go right into lower back. A nice supportive move here, coming in to our lower back, supporting, and then we're going to come back, allowing our body weight to shift, and our knees now act as a fulcrum, which helps open up the sacrum and the SI joint. And the SI joint, again, is where the bones of the hip, particularly the ilium, articulates with the sacrum. And you can see her breath is coming a little easier now and a little fuller into her lower body, because this move helps not only remove any stagnation that might be sensed or felt as physical pain, but also allows the diaphragm to release and allows the breath to come deeper into the lower body. Quite a lovely little move. Continuing here, working on the hip, and you can see now where, and this is a good move, especially if people are just starting body work and wondering about the different ways they can use their own body in relationship to the person that you're working on. That's the blessing of this movement therapy. It allows you to sense where the person is in the moment and make adjustments into how you apply the technique. So the session itself replicates the fluidity that you're trying to bring to the person. So here in question, when we're working hip and lower back, and we've already opened up the sacrum, we just want to continue. I'm just going to put it in here with a nice stretch, even more, a little deeper. You can see the movement here. You always address to what's good for the person in the moment. Here, this supported movement with the foot, it's a bigger surface area, my foot, than my hand. So it's more supportive to the physical structure of the body. And it allows you also to have more of a continued twist as you add some compression. And you can see this line here that's replicated through the fabric here, how it starts to twist open. And now the freer movement through the hip. So quite lovely. And with every move here, like in yoga or in our breath, when we inhale, we must exhale. The movement to open, we also have a counter movement to not only bring this area to conclusion, but also open its counterpart here, the adductors. And the adductor muscles, notorious, well, they're notorious for a few things, but one of the things they are the most notorious for is how their constant contraction can lead to hip imbalance, because they attach right in the center of the hips. So nice either home practice or coming and getting some conscious body work to help open up the adductors is very important to maintain balance through the lower body into continuing into the upper body. You know, it's interesting getting work, because in my mind it always gives you an opportunity to have a clear relationship with the person. And like all good relationships, it really relies on good, clear communication. The key to good communication is being able to listen. And this is the cornerstone of the work, to be able to hold space for the person and listen to what they're asking for, what they need in the moment. You know, time well spent when we can do that for ourselves, and let alone for someone else. You know, we take care of ourselves and then we extend to the other person. So in extending to joy right now, opening up the quads and these larger muscles that connect to the front of the hip, and when they get constricted, they can pull down on the hip, so you have anterior pelvic tilt. And this anterior pelvic tilt can lead to an excessive bend or lordosis in the lower back, which can obviously manifest in lower back pain. So some nice general opening here. Moving to the other side, because we're pretty happy about that movement now. So as I mentioned earlier, when we are in pain, and rightfully so, we start to focus on the area that we're in pain with. So we either rub it ourselves or apply something or take something for it or allow someone to work on it. And because of the way things are, we have a tendency to compensate. So if one side gets tight, we take the burden of doing whatever we're doing and shift it more onto the, at the time, healthier, more fluid, more stable side. So we always want to address both sides in any chronic, particularly any chronic condition. So now I'm working here just to do some of the same things, I believe, on Joy's other leg, but also paying attention to seeing that perhaps the same thing isn't necessary, meaning that yes, it needs some attention, yes, it needs some loosening, and yes, it needs some balancing, but perhaps not the same moves. As body workers, we take a lot of time for self-education. We take a lot of classes, study with different teachers. The best teacher is every time we do a session. And what that starts to tell us, what it starts to reveal, is that not everyone is the same. Not everything is needed to do in a symmetrical way. Perhaps sometimes yes, so you have to hold space for that. Perhaps that is the possibility. But usually it's just moving the body so that you can feel where the restrictions are and apply some movement that is the right thing for the moment. It's a nice way of supporting Joy in this position. So she doesn't have to strain at all. So her relaxation is rather complete, so she can even focus on her breath even more, which is very essential in the work. Some nice compression. She had shared with me earlier that she had had some strain in the side of her leg here, the iliotibial band. Also too, in Chinese medicine, it's also part of a line of energy called the Gallbladder Meridian. And one of the things that the Gallbladder Meridian is designed to do, what it does is that it's a structural meridian. It's on the side of the body, so it really helps us ambulate, walk forward through life. So any stickiness can manifest in the iliotibial band. So I'm just taking some nice sustained stretch, nothing other than what I think is appropriate. I've had the opportunity to know Joy and talk to her, and all that informs how I approach the work. So the type of work I actually do, the amount of pressure, even the tempo is replicated in her, what she shared with me as far as her own personality and what she does for a living. And it's all very much a factor in the work. So I'm just going to allow, that said, rather than go to it, do the tight area, because there's natural holding in this area, that I'm just going to let her body open up to me. I have the contour of my knee here going right into the area that she's feeling some tightness. And there's a sense of her being in a more controlled position to allow herself to come to the technique and to allow herself to let go as much as she can in this particular moment. That's quite nice. as I mentioned earlier, a lot of this can start to stem from immobility here at the ankle joint. So along with working stretching hamstrings and quads here on her left leg, the way I was moving her body gave me an indication that there's some tightness here in the lower portion of the body, below the knee and just above the ankle. So these two muscles here, tibialis anterior and the more lateral muscle group, the peroneals, really affects, as you would imagine, since they attach in and around the foot and ankle, how the foot moves. Tibialis anterior directly associated with the big toe and the ball of the foot. And this reflects so much on our inner balance. Okay, so I want to take the time to just do a little loving rocking. It's very comforting, both to receive and to do. And you can see in this simple movement how it opens up all these three joints that we're concerned with here in the lower body. The hip, the knee, and of course the aforementioned ankle. Look at her foot is starting to get a little looser already. So I'm going to just put the leg into an inner rotation so the musculature of the lower leg comes up, and I'm just going to apply a little pressure here with my forearm. Sustained pressure, technique that where you seemingly aren't doing a lot. It's quite lovely because there's so much internal movement happening here. We're sustained in one place, and Joy has the opportunity to focus on that one area, just that one area, and allow herself to breathe into it and allow the muscle to relax a little bit more. And as far as the giver goes, it also gives me opportunity to really allow my body to relax as much as possible and focus on my own breath. I'm going in and I can feel myself organizing behind my contact, so I'm really feel like the connection a little deeper. It has possibility to go a little deeper. Quite lovely. So we're going to come up here, just add a little traction. So we're continually moving into the lower back. So our goal here is to open up the lower body so that it can give and receive nice support, and then let that support and stability transfer back up into the lower body through the back and hips, and then finally into the spine and head and neck. So just some nice hamstring stretch. I'm going to come down here a little bit. She's got some nice movement, so I'm just lowering myself down here so I can appreciate the movement from a lower position. A little traction move to help open up the hips. It's called ringing the bell. It's a Zen bell, though. There's no noise, really. And we're just going to bring the knees bending and towards the upper body. And you'll notice how I changed my body position to accommodate my weight shift from one foot to the next. So I'm trying to move the knees to the chest to open up the lower back. But as I go into it, I'm shifting and opening up my stance and allowing my arms to straighten so I can let my body weight transfer more cleanly through my forward movement into causing the movement into her lower back. And coming out slowly, and then just adding some nice rotation. My body moving with hers. Just keeping some nice fluidity in both the giving and receiving. and coming to a neutral place and allowing ourselves to use Joy's femurs, these big leg bones here, coming from the hip and coming to the knee. I have them at approximately a right angle here, 90 degrees to the mat, and I'm going to apply pressure right onto her knees, onto her patellas, just letting my body weight come through. And what happens is that the ball and socket of the femur presses into the hip and just coaxes a nice gentleness open in the SI joint where the hips meet the sacrum, the bottom of the spine. Just going to end with a few traction moves here, just to coax a little longer lasting openness in the lower back. Again, in Chinese medicine, acupuncture, acupressure, there's a series of points that we use called subo, and they have different activities and different means of accomplishing movement in the body and helping relieve physical pain. And my knees are going right behind her knees and stimulating a particular point that helps clear any stagnation in the knees so that there's a better movement into the lower back. Well, that concludes this segment here for the first of a three-part series on addressing the commonality of lower back pain and head and neck pain. I hope you join me in my next video where we're going to be addressing the lower back. And again, thank you. My name is Randy Cummins, and I'm with Black Swan Bodywork here in Austin and Chicago, and I look forward to the next time. Thank you.